I'm Carrie. I am a yoga instructor, a massage therapist, and also a physio assistant at a school for disabled children with profound and multiple learning difficulties. So I am making this video for our student body and anybody else that might want to share in this, just as another way for you to connect with your own child, to get them moving in ways that maybe they're not used to moving at home or at school. And it's just a really great way of them connecting into their breath and how their body moves in a fluid way. So what we're going to do in this yoga session is it's a very passive yoga session with lots of massage techniques mixed in with it. It's kind of like an untraditional Thai massage. That's how I like to label it. So I'm going to use my son here, and we're just going to kind of walk through a whole body session, and with lots of different movements, lots of different massage techniques, and hopefully it all makes sense and that you will find some things that are valuable to you and your child. As always, I don't know you personally, or maybe I do, but we're not talking. This is a video. So if anything that I say sounds like it's against what your doctor or physio has told you that your child can move in. Maybe they've had surgery that has fused bones. Maybe they have hip subluxation or problems with dislocation, and you don't think that that would be a feasible movement for you, then always err on the side of caution. This is supposed to feel good. It's supposed to be relaxing so that they can move easily and freely and be comfortable in their own body. Okay, so let's get started. So let's get started. It's going to bring your child into a face-up position, supine position on the floor, and any kind of pillows or anything you need to make them comfortable. We're going to bring their hands onto their tummy, cover our hands over theirs, look into each other's eyes, and take 3 deep breaths together. You ready? Lovely. And we're going to start with the hand, with just a little warm-up hand massage. So we're going to take their left hand in our hands. We're going to meet our fingers together underneath their palms, right where the thumb and the index finger pad meet, right next to the wrist. So that's where our fingers meet. And our thumbs are going to be on top of the wrist. So what we're going to do is we're just going to stretch across and drag our thumbs from one side to the other. Just like this motion. We're just going to do that a few times just to say hello to the top of the hand. Good. And then keeping your hands in the same position, we're going to do the opposite. So we're going to just stretch the bottom of the hand by pulling our middle fingers away from each other, just stretching that direction. And that just stretches the thumb and the index finger and the pinky finger away from each other, giving a nice stretch to the palm of the hand. Then we're going to move on doing some cat kneading. So just squeeze and release, alternating hands, one then the other. Just massaging the palm of their hand, loosening up those muscles and how it relaxes into their fingers, maybe down into their forearm. And then we're going to trace off each finger. So from the wrist, following the bones, all the way off the tip of each finger, one at a time. And we do that twice. You can feel how long the fingers are, and notice how much space they have within each finger. Each finger is individual and different from each other. Good. And then we're going to come into the bro hold. Okay, so thumbs crossed, fingers wrapped around each other, bro hold. And we're just going to start to do some different motions. We're going to do supine and prone, just that rotation, back and forth. It just stretches the muscles of the forearms. We're going to move their thumb towards their wrist and away. So just doing a waving motion of their hand. Start to move into the elbow. So flexing the elbow, hand towards their shoulder, and then straightening. Flex and straighten. And then we're going to do some chicken motion. So bringing their hand down, we're going to bring their elbow out to the side and back in, out and back in. And then doing the whole range of motion. So a nice big circle, as much as they're able. Tracing a nice large circle with their hand. And then we're going to roll over onto their side. So we're going to roll over onto their right side. Okay, however it takes you to get there. Take the time to put some pillows in for some propping so they're super comfortable. We're going to sit in front so they don't feel like they're falling. They can just feel our body supporting theirs, which feels nice and safe and secure. Okay, and we're going to take their arm, their left arm, rest their elbow on our leg, which is nice and comfortable, still holding their hand, and we're going to massage the forearm. We're just going to bring our thumb in between the two bones of the forearm, your radius and your ulna. Radius is here on the thumb side, ulna on the pinky side. And right in between this, there's lots of muscles and loads of connective tissue. It can get really, really tight. And it's meant to be free moving because that helps in the rotation of your palm and your wrist, moving your arm back and forth, that pronation. So we're just going to work to relax that. So our thumb's going to go right in the bases between those two bones. Our fingers are going to wrap around. We're going to squeeze and release. Squeeze and release. Just picking up the muscle, tracing from the wrist up to the elbow. Squeeze and release. It feels really nice, doesn't it, Spence? Just a few times. And once we've done that a few times, we're going to bring both hands around the top of their arm, their upper arm. So our fingers are going to meet underneath, and our thumbs are going to touch on the top. And we're just going to squeeze out to each side. So it's just squeezing into our hands and release. Walk up a little bit more, squeeze and release. Fingers all the way up to the armpit, squeeze and release. You can just make that kind of rhythmic. You'll notice there might be a little bit of movement of their shoulder, and that's a good thing. Lovely. So that's nice and loose. And we're going to kind of come up and we're going to feel into the shoulder. Okay. So on the shoulder blade, we're just going to feel the shoulder blade. And it's a nice triangular bone. So you have the top here and the top of their shoulder. You can feel the top of that. That's the spine of the scapula. And then you have it coming down here. We're just kind of tracing. You'll feel a little point just a little bit below their armpit area. And then it traces back over. So that nice big triangle. Okay? So we're not going to press on that bone, though you can. And then we're going to kind of feel where the spine is, those bony bits of the spine. And we don't want to press on that because that's sore. So right in between that is the rhomboid muscles. Okay, so in between the side of the scapula and the spine. And we're going to bring the flats of our fingers, not the tips because that digs in. It's just the flats of our fingers. And we're going to meet our hands together like this for lighter pressure. Finger on top of finger for deeper pressure. We're going to press in and make little circles. Press in and make little circles, just on those rhomboid muscles. Trying to loosen up the scapula so that wing can move. Press in and circle. Look at your child's face. If it's too much, they might wince. If it feels good, they might smile or just give a sighing breath, and that's a clue that we're doing a good job. Once we've done that a few times, we're going to come up and we're going to go into the neck. So we're going to feel the bones here. So we have the base of the occiput, the base of their skull, and that's right where the hairline usually is. We have the spine, which we don't want to press on. And we have the little bone protrusion here on the top of their shoulder. That can be really sore. So we don't want to press on that. Now if you look here, there's a nice little muscle we can follow along the back of the shoulder from that little bony bit all the way up to their hairline. And that's where we're going to press. So we're going to again use the flats of your fingers, press in and circle. Just tracing that muscle. Good. This muscle helps to lift your shoulder blade up, your scapula. It's called levator scapula. It's like an elevator for it. That's how I remember that. And it can get really tight. And if they're super tight, people wear their shoulders as earrings, which is quite common. And we don't want that to happen. We want lots of space. So lots of little circles. Lovely. And then we're going to make nice. We're going to swoosh in their hair a bit. Maybe make some shampooing motions. After some deep work, it can feel pretty intense. So we want to just smooth that out to let them know that this is all about relaxing, about feeling good. And then we're going to come down and do a nice stretch of the shoulder. So again, that little bony bit right on the top of the shoulder, we're going to cup around that because we don't want to press on it. We're protecting that. We're going to link our two hands together. We're going to make sure our bodies are nice and straight. Their bodies are nice and straight. We're going to take a deep breath in. With straight arms, we're just going to lean back. So it's a nice gentle traction stretch. There's not going to be a lot of movement. It's more the intention of that muscle to stretch and to let go. And the softer your hands are, the more they can relax. So see if you can soften your hands a bit more without letting up ground. Just soften your own hands so that their muscles can relax. Beautiful. And then we're going to come down. We're going to swoosh down, just flat hands all along the length of their spine, one and the other. And we're going to come down into the lower back. Okay. So again, you want to feel where the spine is because we don't want to press on that. So we're just going to locate that. Then right at the waistline, there is kind of the top of their hip bone, their PSIS. So that little bone, and we want to be off of that. So right in between those two bony bits, we're going to just massage along those tight muscles there. So again, hand next to each other for lighter pressure, on top of each other for deeper pressure. Read your child's face to know which one they would like. My child usually likes it a bit lighter. So I'm going to press in with the flats of my fingers and make little circles. Not on the bone, just on that muscle tissue. Good. From the rib cage down to the hip. Doing that about 3 times. Lovely. And then we're going to swoosh from their mid-back down to their hip. And now we're going to do a nice side opening stretch. So their arm can stay here, but if their shoulders are really open, sometimes it's nice just to rest their hand over top. So their arm on the side of their ear. And what we're going to do is we're going to bring our right hand onto their rib cage, our left hand onto their hip. So we cross over. So we're going to take a deep breath in, and we're going to move our hands away from each other. So just opening up that space between their rib and their hip. It's one of my favorite stretches. Again, lighter hands are more effective. They want to feel safe in your hands. So see if you can lighten up without letting up ground. So you still want the stretch to happen, but you're not forcing it. You're just encouraging. Good. One more deep breath in. And then we're going to relax. That comfy stance. Okay, so now we're going to go down into the deep hip, the bum area, because they get really tight. So first we're going to learn the geography. We have the flat part of your lower back, that's your sacrum. We have your greater trochanter, which is that bony bit right on the side of your hip. And we have the top of your pelvis, that PSIS, that spine. So those are your three bony bits. And in the middle of that triangle, you can put your fingers right there, right in the middle of the posterior. And again, you can do hand next to each other for lighter pressure, or hand on top of hand for deeper pressure. With the flats of your fingers, you're just going to press in and make little circles. If your hips are tight, it pulls on your pelvis, which can cause a lot of problems in your lower back. It can pull on your hamstrings, as they're on either side of that. So by just loosening up these deep hip muscles, you're making a huge difference in their body, especially for people that sit all day. It gives them a lot of relief. So just a few circles right around. Maybe moving your fingers around a little bit, staying off the bones, just in that deep, the big muscles there. Good. And then we're going to do a bit of a squeeze. So again, you're feeling that greater trochanter, which is right on the edge of their pocket usually. That's that big bony bit. And we're going to cup around there. So one hand's going to be on their bum, one hand's going to be on the front of their hip, just cupped around that greater trochanter. You're going to push in and squeeze all around the circle. Just squeezing your hands together. And then we're going to swoosh from their hip down to their knee, maybe even their toes if their legs aren't too long. So they can feel that connection of the whole length of their leg, how their hips are connected to their thighs, to their calves, all the way down to their toes. And then we're going to roll back over onto our backs. Okay, let's straighten you up. Taking your time getting in a nice position. We're going to bring both of their knees up over top of their hips. Is it your waistband? Okay, using any pillows you might need. Is that better? So we're just going to do a spinal release. So we're trying to find their sacrum, that flat part of their lower back. And we want to be balanced on their sacrum. So we're going to keep their knees directly over top of their hips, holding their knees in our flat palms, with their feet hanging heavy. And we're just kind of feeling where their sacrum is. Now for Spencer, it's pretty level, because he's a pretty able guy. But if your son or daughter is maybe has different abilities and different kind of body, then maybe we have to search for it. So maybe to find the flat part of the lower back, you bring your knees over to find it, or maybe over here, or maybe just one leg. Just kind of working around to see where the flat part of the lower back is. And once you found that, then you just kind of hold. Sometimes we do little circles in both directions. Now we're going to keep the left knee in, drop the right leg down, feel it's nice and flat, and we're going to go into some flexion of the hip and knee. So we're going to bring their knee up into their chest and then straighten their leg. Knee into chest and straighten their leg. So we're looking for fluid motion. If they have different kind of patterns, it might be they kind of catch a little spot and they want to jerk or they want to move around and it feels sticky. And if you find that sticky point, you just slow down, you honor it, and you move just a little bit on either side of it. So it may look different than what Spencer's showing you here. So we just kind of do what your son or daughter wants, their body wants you to do, wherever that may be. After we've moved about with that nice fluid motion, the next time we come in, we're going to just hold their knee up into their chest. And just give a nice stretch there. My hands here on his right leg just to guide and to keep it down. We're only pushing in with the left knee as far as this right leg will allow. So if it starts to lift up, we've gone too far. That's his body telling us that it's too deep of a stretch. So in just that our hand here on his right leg really lets us know what it's feeling like. So his leg stays down, he's comfortable. I'm going to push in a bit more. One more deep breath in. Exhale. And then release. Now we're going to straighten the leg out. We're going to swoosh the whole leg. And bring that left leg down. Let's go to the other side. Okay. In a funny position. Okay, so now we're going to do the other hand, the right hand. And we're going to start where we had started on the other side. So we're just going to grab their hand. So our thumbs are meeting on top. Our fingers are meeting together below, right at the base of their hand where it meets their wrist. And we're going to stretch our thumbs away from each other a few times. Then we're going to stretch our fingers away from each other, opening at the palm of their hand. And then doing the kneading motion, one and the other, a bit of squeeze and release. And then tracing each finger and thumb from the wrist all the way up the fingertip. Let's do that 2 times. And we're going to come into the bro hold. So thumbs crossed, fingers wrapped around each other. We're going to do some wrist motions. So thumb towards their shoulder and then away, moving it back and forth. And then rotating, palm up, and palm down. And bending at the elbow, so thumb towards their shoulder, and a flexion, and extension, And then we're going to bring our hand down and do some chicken arms. So opening the elbow out to the side. Whole arm circles. Okay. Nice big circles. However that looks. And from here, we're going to roll over onto his left side. So let the right arms up. Using any pillows you may need. Bring your body, your thigh right in next to his tummy so he feels that support. He doesn't feel like he's going to roll over. Feel comfy? Then we're going to do some forearm work. So again, we're feeling the two bones of your forearm, your radius and your ulna, and right in between the two bones are loads of different, lots of tendons and muscle and lots of connective tissue, which gets super tight. And we want it loose so we get lots of pronation, lots of movement of your wrist. You can go in either direction. So we're going to press our thumb into that space between the bones with our fingers on the other side. We're going to squeeze and release, squeeze and release. Going from the wrist all the way up to the elbow and back down just a few times. And once we've ended at the elbow, we're going to bring both hands around his upper arm. So fingers are meeting underneath, thumbs are meeting on top. We're going to squeeze the muscles away from the bone. Give them a squeeze and release. Moving up, squeeze and release. Up into the armpit, squeeze and release. And just doing that a few times. And then we're going to come up into the shoulder. So again, we're going to feel where the scapula is, top of the scapula here, side of the scapula, and how it meets at a point and then comes back up to the shoulder. So that's the scapula. And then, so that's the edge we're looking for. Then we have the spine here, and right in between those two areas is your rhomboid muscles, which get super tight. So we're just going to press in with flat fingers and make little circles. Just the whole length of their shoulder blade, from top of the shoulder down to that tip. Again, in that space between the bones, so right on that soft tissue. You can do finger next to finger for lighter pressure, finger on top of finger for deeper pressure. And then we're going to swoosh from shoulder out to the elbow and come up to the neck. Shoulder. My boy. Okay. So again, we're going from the hairline, the occiput, down to the shoulder, and you have this little bony protrusion on the top of the shoulder. It's really noticeable. You can usually see it. That's really sort of press on, and we don't want to. And then right along the back point, right along here, that's where we're going to trace with our fingers. So we're going to bring the flats of our fingers here next to his hairline and make little circles all the way down. Staying off the bony bits and staying in the back, because the front of the neck can be quite sore as well. It takes quite a steady hand. After you've done that a few times, we're going to come into his hair and just make nice. So tracing his hair, maybe making some shampooing motions. So it feels good. Loving hands. And now we're going to do a nice traction stretch. So again, you find that pointy bit at the top of their shoulder. We don't want to press on that. We're going to go around it. I'm going to cup it with one hand, cup my other hand, so that is very protected. We're going to straighten up our own spines and arms. I'm going to take a deep breath in. And when we exhale, we're just going to lean back a little bit. So with gentle hands. It's meant to be a nice gentle traction stretch. Just encouraging his shoulder down away from his ears. Opening up the neck. For a nice deep breath in. And release. Okay. Coming down to the spine. Down to the lower back. So we have his spine here. The top of the hip here at the waistline. So we're going to, in the bottom of the ribs here. So we're kind of going in that section here, from the ribs down to the hips. And not on the spine itself, but right above it, right where those muscles are. And again, fingers next to each other for lighter pressure, on top of each other for deeper pressure, using the flats of your fingers, so you're not digging in and causing pain. Making little circles. And we're going to swoosh from the bottom of his ribs out to his hip. And then we're going to do this traction stretch. So again, you can keep the arm down if that's more comfortable for your child, but if they have nice open arms, sometimes it's nice to bring their hand up so their arm rests on their ear. And we're going to open up this space between the hips and the ribs. Okay, so I'm going to put my left hand on his rib cage, give it a nice cradle. Right hand's going to come onto his hip. I'm just going to take a deep breath in and move my hands away from each other. So it's not really a pressure in, it's a pressure wide. And we're doing it with nice gentle hands. And we're just encouraging that space to open. And the softer your hands go, the more they can trust you and allow themselves to let go. So see if you can soften your hands up a bit more. And follow that movement as they open. Okay, take a nice deep breath in. Exhale. And then release. Hand comes back down. Hip hits up. And then we're going to come into the deep hip. So we have the top of the hip here, we have the greater trochanter, which is that bony protrusion here, and we have the flat of the lower back here. And right in between those 3 points, we have the deep hip muscles. And we're just going to do finger on top of finger probably. You can use a bit more pressure in this area and make little circles. After we've done that for a few times, we're going to do the squeeze around the greater trochanter, which is that bony protrusion. We're going to find that again. It's right there. It's usually along the seam near the bottom of the pocket. If you're confused, And then we're going to cup our hands around it. So one hand in front, one hand behind on the bum. We're going to take a deep breath in, and we're going to squeeze. And we're going to do that a few times all around it. Always looking at your child's face to make sure it feels good for them. Listening to their body cues, whether their eyes are closed, they're breathing deep, maybe their tummies are gurgling. Those are all signs of relaxation. And then swooshing from the hip down to the knee, maybe even the toes, linking the whole body together. Here you roll over. Okay, back onto your back. Any pillows you may need, a pillow in your bottom. We're going to bring the knees up over top of the hips. For the spinal release. Let your feet hang. There you go. Give them space for their feet to hang. That gives a bit of gravity situation. And this time we're going to do a little windshield wipering. Relax. Circles. Maybe even a little bit of bicycle pedaling. Whatever feels good. Then we're going to straighten out the left leg, keeping the right knee in. We're going to do some nice, gentle movements of flexion and extension. Again, we're going for smoothness of motion. It may not be to their furthest range, but that's okay. We're just kind of loosening up those joints, getting that synovial fluid moving a bit. Nice and gentle. And then we're going to keep the knee in flexion. Again, your hands on their left leg, and that is just a tool for you to know how far to go. So if their leg starts to lift up, you've gone to their edge. So back off just a touch. And if their leg's staying down and it's nice and comfortable, you can press in a bit deeper. Take a nice deep breath in. Exhale. And then release. Stretch the leg out. We're now going to bring both feet flat so their knees are bent. Okay, I'm going to trap his feet in between my legs. We're going to open his knees out to either side and butterfly pose or Baddha Konasana, round angle. And again, we're resting right on the flat of the lower back. We're not pressing down. Gravity gives enough. And if it's a really tight stretch, sometimes you can just support underneath their knees, and that gives them the support they need to let go more. Feel safe in that. And we're just kind of taking in some information. If it looks like one leg's a lot looser than the other and opening out more to the side, we keep to the tighter leg. And we find that space where they're kind of balanced right on their lower back. And as the tight leg relaxes, we allow the looser leg to let go as well. And that just keeps that balance. Good. And then release. We're going to bring their knees back together. Knees over top of the hips. We're going to open their knees a bit wider, and we're going to bring both knees up in towards their chest, kind of like their knees are lined up with their armpits. Spencer. One more deep breath in. Exhale. And then release. Feet flat. We're going to walk their legs back. We're going to hold their heels in our hands. Okay, their toes facing up. Okay, we're going to straighten up our own spine. I'm doing a gentle traction stretch. We're just going to lean back, and that's encouraging their heels to come towards us, which lengthens the whole back of their body from their heel all the way up to their lower back, possibly even higher. Relaxing their feet down. We're going to do a double foot massage. So we're just going to bring our fingers underneath their feet, our thumbs on top, and just give a squeeze from their heel up towards their pinky toes a few times. And then inside, we're going to put our thumbs right on the heel, on the inside inner heel, and we're just going to lean in and press our thumb from the heel all the way up to the pad of a big toe. And then in the middle of the foot as well, middle of the heel, all the way out towards the middle toe. And then we're going to trace each toe. The baby toes, fourth toes, middle toes, second toes, and big toes. And then swoosh from their knee down off their toes, just a few times. We're going to end as we started, so we're going to bring their hands onto their tummy, put our hands on top of theirs, look into each other's eyes, and take one big deep breath. Thank you, Spencer. I love you. And that's all. So that's the whole practice, or one of them. It can change each time. So hopefully that made sense to you, and you can find some value in that, in how you relate and work with your child. And that is another great chance of you bonding together and feeling good together. So thank you so much for joining us today. Look forward to hearing you soon. Bye.